So 4 new cases in Queensland overnight, 2 of them in hotel quarantine, and they acquired the infection overseas, one from Slovenia, the other we're still tracking the travel history of that person. Then 2 community-acquired cases. One of them is one of those miners who returned from the Tanami mine in Central Australia and returned home to Ipswich area and was immediately tested when they came. We did 1 test on that miner, and at that stage it was equivocal. So it was really early in their illness, and we wouldn't call that a positive. Then we repeated the test later, and at that stage it was definitely positive, which means the first test when they first went into quarantine was very, very early, which means I hope that that is low risk. But we do know it's the Delta variant, so we'll be contact tracing everyone on that plane, everyone that miner's been near. Now, we've got hold of all of the other miners across the state, and we've got them in quarantine, and we'll be testing them, but we're not out of the risk time yet with all of those other miners. So that is a continuing risk for Queensland. Then the other case is a brand new community-acquired case that at this point in time I can't be definitive how they got it. I should get genome sequencing by the end of today, early tomorrow at the latest, and then I'll be able to work out where they've got it, because we do have that alpha variant circulating in our community because of the Portuguese restaurant cluster that we've got evolving, but also this particular individual worked as a casual and they sat outside the COVID ward at the Prince Charles Hospital. So there might be a link there, but genome sequencing will tell me what's occurred and where that risk is. So we now in Queensland have 4 incidents that are concerning me. We have those miners who've returned from the Tanami mine. We have those 5 flights that crew member was positive on with Virgin Airlines, and although only 2 of them came into Queensland, we know the other 3 potentially had Queenslanders on board who have then come back into Queensland. So I'm worried about all 5 of those flights, and we're working through those. Then we've got the Portuguese restaurant cluster, and I've still got 1 case there that's unlinked epidemiologically. It's linked through genome sequencing, but I don't know the exact person that they got infected by. So I'm worried that there might be a case out there in the community that I don't know about. Then I've got this 4th case that may be linked to that case through the Portuguese restaurant cluster, or it may be linked to one of those overseas travellers that's been admitted to the Prince Charles Hospital, or it could be another linkage that I've just got to work through. Now, this case, I need to go into detail where they've been. So they first developed symptoms last Monday, over a week ago, and they've been infectious then from 7 a.m. the Saturday. They've been out, they live in Sandgate with their family household. There's 4 other people who live in that household, and they've been to the Sandgate Woolworths. This is so important. I'm going to refer to some notes, but we will put all this information on our website and we'll put it out in a press release. So at this stage, but please remember, I only found out about this when I got up this morning at 5:30, and we've been furiously trying to get more information. So it will get clarified through the day. But I want to give people a heads up. So Sandgate Woolworths, 9:30 to 10:30, Sunday a week ago, and the Bay Health Gym from 10 to 12 on that Sunday. Then they worked a shift at the Prince Charles Hospital from 3 p.m. to 10 p.m. on the Tuesday and Wednesday last week. Then on Thursday, they went with their family on VA 369 from Brisbane to Townsville on Thursday the 24th at 10 a.m. They were in the Brisbane airport for 1 hour prior. Then when they landed at Townsville Airport, they were at the Cafe Brewery in the airport there for 1 hour before travelling to Magnetic Island. Then they spent from midday Thursday to midday Sunday the 27th at Magnetic Island. So I'm asking every single person, I understand there's about 2,500 people on that island, to come forward and get tested, whether or not they've got symptoms. That's really important, and we've got a fever clinic there on the island. Then on Sunday the 27th, they travelled from Magnetic Island back to Townsville. They went to the Sunday morning markets in Townsville City late morning, then caught V8 374 from Townsville to Brisbane on that Sunday the 27th, 2:55 p.m, then came into Brisbane Airport. Now, I know I've had that mandate mask wearing in airports throughout for many months now. It is absolutely critical. So people who are in the airports around those times, if you've got any symptoms at all, hopefully you were wearing a mask so you're safe, but any symptoms at all, you've just got to come forward and get tested. So we'll put out more specifics when we get that about where this lady might have been. So 2 of her family members who live in the same household are unwell, so we're urgently testing them, of course, and 1 of her close friends is unwell, so we're urgently testing them. So we'll get all those results through the morning and make sure we get that information out there. So that is critical. It is a significant risk, which is why, as of 6 p.m. tonight, which I recognise is very little notice for people, but at 6 p.m. tonight, the 11 LGAs that we declared from 1 a.m. this morning to have those increased restrictions will go into lockdown with only those 4 reasons that everyone knows so well as to why you can leave your home, and that will be in place till 6 p.m. on Friday evening, unless there are issues in the past. As you know, we always review that on that last morning to work out what needs to happen.